My name is Amy and I have migraines, and the last few months I've been taking Aimovig, and I have watched some videos on taking it. I noticed that many of these videos don't really, they seem to make a big deal about taking it, and it's pretty straightforward actually, pretty easy. It's not a very painful medication to take, although I tend to have some side effects after taking it for a couple of hours. And I thought that I would do a little video just showing how to take it and how it works. So this is Aimovig. This is the 140 milligram dose, and this is how to do it. You get a box. I get a box of 3 of these, usually it's easier than this. Anyway, in the box you get a set of instructions and the Aimovig itself. So the instructions are a little daunting. There are 2 sets of instructions. One set is for doctors, and really you don't want to do anything with these at all. These will scare you, and they have a lot of information that as a lay person you're probably not going to understand. So these are the instructions for the user, and they look pretty scary. You know, it's like all this stuff. Really, it's not that bad. All it is it introduces you to the vial, which has this window inside. You can see it's like a level. It has clear liquid in it. This is the medication. And you shouldn't see anything cloudy in it, which we don't. It's clear, and there's a bubble in there indicating that there's a little bit of air in there, which is fine. So when the medication is shot into us, a little yellow thing will go in there like that. That will indicate that the shot has gone in successfully. There's also this cap here. That's what you press to release the medication. And this is what you take off to reveal the needle. Now the needle is in here, and unless you take this off and look inside, you're never going to see the needle. So don't worry about it. You're never going to see it. It's about as wide as a hair, so it's not really something that you need to worry about. So you need to take this out of the refrigerator because it is something that needs to be refrigerated. You need to take it out at least a half hour before you put it into your body, or it's going to be very, very cold and uncomfortable. I made that mistake the first time. Don't put it back in the fridge after it's already warm. So first thing you do is take it out. We already did that. Inspect it. We already did that. Gather the materials. Well, what do you need? You need this. You need alcohol wipes, or just some cotton balls or something to put some alcohol on you, and a Band-Aid because you might bleed a little bit afterwards. And they want you to have a sharps container. What I have done is just put this back on here, put it back in here, and thrown it away. Prepare and clean your injection site. There are several places on the body where you can put the injection. You can put it on your arm, which is really painful if you've ever had a flu shot. And it's also just difficult to do, so I don't recommend it. You can put it on your stomach, which if you have a lot of fat, I guess that works. I have some fat, mostly skin here. I've never tried that. I don't know why anybody would, because you can do it right here on your leg, boom, like that, done. It's easy to get to. You don't have to be pushing anything around, so that's what I'm going to do. And you can, if you want to, you can mark the place where you're going to make the injection, just so it's easier for you. I was going to do that, but I don't feel like drawing on myself, so I'm not going to do that. Chickened out of that. But you clean off the area, and I'm cleaning off an area about 2 inches square, right like that. And you want to make sure that it's just where there's subcutaneous fat. Now we're going to take off this part here, the part that covers up the needle. See this little yellow thing that comes out? That's going to go right on here. You want to make sure that that's in the area that you cleaned. Now once that's there where you want it, you want the liquid there where you can see it. Make sure that the bubble's up there at the top so you're not injecting that. Place your thumb up here on the top. And then just, I didn't feel anything. And as soon as the yellow goes down there, I heard that little click there. That means that it's all done. The needle's already out. It's done. That's how easy it was. So what I'm going to do is I'm going to put this back in, which has worked in the past, but it's not working this time. And I'm going to place this back in the container because the needle is not going to get anywhere here. It's not going to hit anything, and that should be safe. And I'm done. Now there is a little blood here, so not much. So just going to put a Band-Aid on there to show that that's what you're supposed to do. And that was it. It's not particularly dramatic. It's not, certainly wasn't painful. There are a lot of videos that show the whole family getting in there, and I think that creating the whole big issue, making it a big event, is part of what makes it hurt and makes it difficult. And I've also seen videos where somebody's just sitting there and just sort of not even paying attention, doesn't wash it or anything, just sort of plunges it into the side of their thigh. And that concerns me as well. You want to be clean about it. You don't want to get an infection. But that's it. And Aimovig has been pretty helpful for me. I'm tapering off another medication right now, which that's been kind of difficult. I'm having some migraines right now because of that, not because of the Aimovig. So it's kind of a weird thing right now, but that's how you do it. And it's pretty simple and straightforward. And for the most part, I'm pretty pleased with this medication. And that's it. So, bye.